Hello, how are you all? Hope you all are fine and preparing well for your AMC Part 1 examination. This is Dr. Zahra and we are doing some important line from John Murtagh book, the most important book for AMC Part 1 examination preparation. And if you are following my all discussion, so your gynae op section will be more easy to pass. Um, let's start the second chapter, chapter number 92, family planning. So first we will cover the most important topic, which is emergency contraception. Let's start. So today discussion will be on emergency contraception. So it's a very small topic, but frequently it is repeating in the exam. And once your concepts are clear, you will be able to solve 90% of the questions from the emergency contraception easily. All right. So first of all, clear your concept that there are three type of emergency contraceptions are available. Out of these three, there are two pills and one intrauterine copper containing device. All right. So what are the pills available and what are their its duration? So for emergency contraception, okay. So there are two pills and one intrauterine contraception device. What are those two pills? Number one is ulipristal acetate. Ulipristal acetate, which is 30 milligram. All right. So the dose of ulipristal acetate is 30 milligram, and it is taken as a single dose. All right. And within 120 hours, you can take this ulipristal acetate as emergency contraception. Okay. So they can mention hours or days. So if they are mentioning days, so within 5 days ulipristal acetate is appropriate for emergency contraception, or 120 hours. All right. So I'll show you the picture to remember the how it's look like. So in the exam, the picture will come in your mind and you will easily remember this emergency contraception. All right. So the common name of ulipristal acetate in the market, it is available as Ella-1. All right, and the dose is 30 milligram, and it's used as emergency contraception, one tablet within, yes, you all are correct, within 5 days or 120 hours. All right, don't forget this duration is very very important. All right. The second is, so I mentioned before that there are two pills and one intrauterine contraception device. So which is the second pill? Second pill is levonorgestrel 1.5 milligram as a single dose within, it's wrong, it should be taken within 72 hours. All right. It's mentioned in the down in the paragraph that levonorgestrel taken as an emergency contraception, which is licensed for the use only up to 72 hours after intercourse or within 3 days. All right. So levonorgestrel 1.5 milligram, and one more important thing about the levonorgestrel pill is that if the patient is obese, like overweight, BMI greater than 26, and if the weight is greater than 70 kg, then in those patients it should be taken as double dose. So levonorgestrel pill, two pills they should take if the weight is 70 kg or more and BMI is greater than 26. All right, and it should be taken up to 72 hours. It's mentioned in the down in the paragraph that it is licensed for up to 72 hours. All right. So there are two pills. I'll show both of the pills to remember in the exam, so the picture will come in your mind. Upside is ulipristal acetate, 30 milligram is the correct dose, and the down is levonorgestrel. It is also a pill. So it's just to remember that these are the two pills. These are the oral form of the emergency contraception. All right, ulipristal acetate within 120 hours or 5 days, and levonorgestrel 1.5 milligram within 72 hours as emergency contraception. And if the patient BMI is greater than 26, and if the weight is greater than 70 kg or more, then those women should have take the double dose of this levonorgestrel 1.5 milligram as emergency contraceptive pill. All right. So we have already discussed the two pills as emergency contraception. The third most important emergency contraception is copper containing intrauterine device. And what's the duration? It can be inserted same like within 5 days. Within 5 days. All right. And the safest method as emergency contraception, the best method is copper containing intrauterine device, which is having a least failure rate, and we can also insert as emergency contraception even 5 days, within 5 days if ovulation already done. So also we can insert this device. But ulipristal acetate and that levonorgestrel pills, they have the mechanism to prevent ovulation. So once ovulation have already achieved, so it has a highest failure rate and it will not work. But copper containing intrauterine device also work, but it should be within 5 days of unprotected sexual intercourse. All right. So what's the mechanism? These are 3-4 lines. Let's clear this. Ulipristal acetate is a selective progesterone receptor modulator that act by preventing or delaying ovulation. Alright, so the mechanism of action is prevention or delaying the ovulation. It does this more effectively than levonorgestrel emergency contraceptive pill. Alright, so ulipristal acetate is more effective, and it is which is licensed for only up to 72 hours after intercourse. So levonorgestrel emergency contraceptive pills is licensed for up to 72 hours, and ulipristal acetate is up to 120 hours or 5 days. Effectiveness for both is improved the earlier they are taken. As earlier they are taken, then it is more effective. The copper containing IUD is highly effective at 99% and can provide very reliable ongoing contraception. So if the patient wants the ongoing contraception, then she can also further use this contraception as ongoing contraception. So she no longer need any other contraception if she's using IUD, intrauterine copper containing device as emergency. Then she can further use this contraception as reliable ongoing contraception. All right. So it may be appropriate to advise the woman seeking postcoital contraception to return for pregnancy testing in 3 to 4 weeks. So it is very important whenever the patient is taking the emergency contraception pills or copper containing, she should test for pregnancy testing in 3 to 4 weeks, and depending on her risk. All right. And if she's having a high risk for sexually transmitted infection, then she should, for example, if the patient is for the rape patient, and you have given the emergency contraception in those patients, then those patients should also screen for sexually transmitted infection screening and need for ongoing contraception. If she wants ongoing contraception, then she can also have a discussion at 3 to 4 weeks for the pregnancy testing and then STI screening in those patients in which emergency contraception has given. All right.